guys, this is Al, focusing today on ICRU report 89, number 89 for the brachytherapy. Therefore, a couple of things that we want to talk about is like first, according to the GEC or ESTRO, which is European Society of the Radiation Oncologist Organizations, is basically first defining the higher risk CTV, which as the time of the kind of contouring, the oncologist basically put together the HR, the high risk CTV, which includes the GTV plus the whole cervix. And they actually presume the tumor extension in adjacent tissues, like for the clinical assessment and also residual zone, for example, that they see on the MRI images. And they don't consider any safety margins for that. Therefore, this is for the higher risk CTV, and also there is also another explanation called intermediate risk CTV, which for that case they use also they use margin like 1 to 1.5 cm margins chronically and 0.0 cm anteroposteriorly and 1 cm laterally. That we don't go to the details, which is for the radiation oncologist. But what is the traditional concept really? The traditional concept is when you're prescribing to a target, the prescription dose is the planned dose to cover this target as completely as possible. Or in another word, prescription to 100% isodose, which is to cover the target volume. This is according to ICRU 89, which is super important. But then we come across to the three vocabulary. The first vocabulary is planning aiming dose, which is set of the dose and dose volumes constraint for a treatment. The second vocabulary is prescribed dose, which finally accepted the treatment plan, which is assumed to be delivered to an individual patient. And finally, the third one is delivered dose, which is actually delivered dose to the individual patients. Therefore, this is the concept from the ICRU 89 that we are talking about. Then in some cases that basically here we want to talk about GYN cases, there are some organ at risk that is involved for the GYN cases is, for example, rectum and sigmoid, which they might bleed, and we also want to consider the dose to the overall wall. And the second one is the bladder, which is dose to overall wall again, and this is kind of another organ at risk. And finally, we want to talk about like a vaginal stenosis, ulceration, and adhesions. These are like organ at risk and partially the morbidity that we have for organ at risk that we have in the GYN cases. But if we wanted to go to the basic concept, when we wanted to record for the treatment planning we wanted to do for all of the GYN cases and talk about morbidity, and typically is associated with the small volumes that receiving high doses. For this reason that ICRU 89 focuses on absorbed dose to a very small volumes like 0.1 cc and 2 cc, which is super small volumes. And those two very small volumes are significantly different. And they, as the result, they have a different morbidity pattern. which basically we wanted to for the bladder, rectum, small bowels, and sigmoid and rectum, we wanted to record this one for the patients. And this is actually, you can see that in the figure 6.4 in the ICRU 89 in the details, that very intuitive, and you can really see what they were talking about. And now we have 3 levels, which is, we call it organ at risk reporting. Therefore, level 1 is basically bladder and rectum contouring, and we wanted to record the dose to volume of 0.1 and 2 cc. And also we wanted to have rectal vaginal reference point. That is also part of ICRU 89 that we use it for the treatment planning. Level 2, which basically is level 1 plus, including the sigmoid and bowels and upper vagina points, which is another subject that we can talk about it. And level 3 is level 2 plus, vagina contouring, vaginal reference, length and volume, bladder subvolume, including neck and wall of the bladder, anus, and remaining volumes. Therefore, if you imagine that the patient GYN case come to the clinic, first of all, they should have finished the external beam radiation therapy, or EBRT, that basically the prescribed is like a 4,500 centigrade, which could be delivered in 25 fractions times 180 centigrade for the patients. And then when they finish, they come to, for example, get treatment, for example, 4 fraction times 7 gray or 700 centigrade, which what is important in also high dose brachytherapy is using the radiobiological model, which basically we wanted to know what is the equivalent doses after getting the treatment. Therefore, basically what we recorded in the clinic is according to the GEC-ESRO and what we have from external beam therapy. We wanted to make sure that at the end, the planning aim is this plus the 4 times 700 centigrade plus 4,500 centigrade from external beam radiation therapy is good around 84, 85 gray, which the dose to this 2 cc that we talk about according to ICRU 89 for rectum and sigmoid should be less than 70 gray. And then for bladder, this equivalent dose at 2 gray or EQD2 should be less than 90 gray. Therefore, you will see that in the most of the clinic, when they record, the physicists record with the radiation oncology, they definitely go to this total dose, equivalent dose at 2 gray or EQD2, and make sure that they meet ICRU 89 or GEC-ESRO from European Radiation Oncologist Organization. And as we said, for rectum, bladder, sigmoid, and a small bowel, we should have very consistent numbers for those to the 2 cc that we wanted to report it for the patient. And that's what we do in the clinic. And for MR or CT, depends on what modality to use. That this is another subject we can talk about. we definitely wanted to look at one of the Red Journal publication for 2007. And in this table, actually, the authors very nicely put the OARs, which, as we said, is bladder, rectum, sigmoid, and also a small bowel. And they look at all of the dose metrics for MRI and CT in the different volumes of 0.1, 1 cc, and 2 cc. And they give you the idea that each of these volume, a small volume, how much dose they get, which is a super important concept. Therefore, I wanted to end this video and thank you for watching the video, and stay safe and have a wonderful rest of your day. Bye.